Okay, ladies and gentlemen, we might just get started. My name is Nancy. I'm a clinical nurse with the Mater Refugee Service over at the Mater Hospital, and I welcome you on behalf of Meryl Jones, the Acting Nurse Unit Manager, who can't be here tonight. Now we'd like to move on to Maureen Fordyce, I'm guessing. Excellent. So Maureen is the manager of AMPARO Advocacy Incorporated. Not sure if you have dealt with AMPARO before. Fabulous not-for-profit organisation here in Brisbane. They undertake independent and systematic advocacy on behalf of vulnerable people from non-English speaking backgrounds with a disability. Maureen has worked at AMPARO since 2006 and prior to this has worked in other advocacy agencies promoting the rights and interests of people with disabilities. Since joining AMPARO Advocacy, Maureen has developed a deeper understanding of the significant disadvantage experienced by people with disabilities from diverse cultural and linguistic backgrounds who come to Australia as refugees and migrants, and in particular the difficulties experienced by people who do not speak English as a first language. I think we can all agree that this is a very challenging sector for our professions, and welcome Maureen.
Thank you. PowerPoint, where is it? Here come. Just
Here we go.
Going to do the clicking.
You just click
That one. Okay. Okay. This is where good evening everybody. Glad to be here, lovely to see you all. This is where I wish I had bifocals because you're all very blurry now. But I need to have my glasses off so I can read my notes one day. In this evening's presentation, I'd like to share some of AMPARO's learnings about our work with people from culturally and linguistically diverse backgrounds with disability and their families, and in particular people from a refugee background. We hope that the information that we share with you tonight will give you an appreciation of some of the challenges that people are experiencing and what you might be able to do to help people to access the NDIS. So AMPARO is a not-for-profit community organisation. We're funded, as already been said, to provide independent, individual and systemic advocacy on behalf of vulnerable people from culturally and linguistically diverse backgrounds. We advocate on behalf of people who may not have a voice themselves. They may not have anyone in their family who are able to speak up on their behalf and assist them to get their needs met. So the individual advocacy is within the Brisbane area. We're only funded one individual advocacy position, and we advocate for people between 0 and 65 who live within the Brisbane area. Our systemic advocacy aims to address the additional barriers that people experience and aims to influence positive, sustainable changes to policies, practices and resources within both government and communities to make a difference in the lives of the people that we're here to support. Our advocacy addresses issues of social and economic isolation, unfair treatment and discrimination. That's right, yeah. Our experience is that language and cultural differences make it much more difficult for people with disabilities and their families to understand important information and to successfully negotiate what are often complex systems of support. This is particularly so when systems are not designed to be responsive to people's needs or to deliver outcomes, equitable outcomes to them regardless of their cultural or linguistic backgrounds. AMPARO has provided extensive feedback on the design and delivery of the National Disability Insurance Scheme, both to the NDIA, to the state and federal governments, and to the Joint Standing Committee hearings on the NDIS. Since 2013, we've advocated for the NDIS to be designed in a way that would meet the needs of COLD participants. So the majority of the individuals that we work with at AMPARO are from new and emerging communities and a refugee background where they and their families are experiencing multiple and complex layers of disadvantage, not accessing specialist disability services and requiring more intensive support and advocacy to have their needs met. Many are experiencing socio-economic disadvantage with high levels of unemployment, but working hard to get access to education and gain employment. They're often experiencing high levels of housing stress that we find, spending a significant proportion of their income on private rentals. Many are experiencing ongoing effects of torture and trauma and need ongoing counselling. Many of the people that we work with have low English proficiency and are learning a new language and need access to interpreters. They also often have complex unmet health needs. This is a result of having spent often many years in refugee camps or countries with little capacity to provide good or even basic health care. And most, I would say, have had no experience, as I said, in terms of accessing services, and not surprisingly, most haven't heard of the NDIS. So AMPARO has been providing information to coal communities to help prepare them for the rollout of the NDIS across Queensland since 2015. This work has been funded by the Department of Communities, Disability Services and Seniors. This work has included in the last 18 months of this work has been very targeted engagement, sector development work with new and emerging communities across Brisbane, Logan and the Moreton Bay areas, with a focus on identifying people and families that were most isolated and assisting them to understand and get ready for the NDIS. So, sorry, I should have introduced you to Jo Cochrane. Jo has been doing this work with us since March last year, and she's currently supporting a team of 18 bicultural community educators who've been delivering this information to their communities across these regions. Later we have Vanatsi, one of our bicultural community educators, who'll speak about her engagement with the Burundi community. As part of this work, we've done a number of things, including creating resources and materials to assist coal communities to understand the NDIS and to redress the low availability of accessible information about the NDIS. So there is some information out there, and I think probably a lot of you have got it, which lists the fact sheets that AMPARO has developed. So we've developed a number of fact sheets. One is Understanding Disability in Australia, the other is What is the NDIS? And those two fact sheets are available in 33 languages and they're on our website. So please make use of those and share those with your colleagues, individuals and families. Through this work, AMPARO has also developed a fact sheet for interpreters to help explain to them what this NDIS is and to help explain the terminology that's used. There's a lot of jargon used in under this scheme, such as reasonable and necessary and aspirations and goals, and those words are very difficult to interpret. So AMPARO and Lalita Lakshmi has led that work, has developed a fact sheet for interpreters, and that's also available on our website. The project has also developed information kits about the NDIS and checklists to help families and the bicultural workers to look at what it is they need to understand and how they can start to think about what their supports might look like under an NDIS, what things that they could benefit from with the NDIS. So some of those kits have been translated where individuals will benefit from that. We've translated those in a number of languages. So we've been informing the sector quite broadly, the multicultural sector, talking to settlement workers and multicultural workers, community leaders, so that they understand the NDIS, so that they can spread the word to their communities and the people that they work with. We've been providing face-to-face information sessions with our bicultural educators, raising awareness within government and communities about the need to implement culturally inclusive strategies in their work, including the NDIA, and helping communities to learn about what is disability to start with, to understand disability, and to know about the fact that in Australia, people with disabilities have a right to a good life and what that might look like. So through this work, we hope that we've been able to increase understanding within families and communities about the rights of people with disability in the Australian context, to increase their awareness and understanding of people from coal backgrounds with disabilities, their families, their communities, of the benefits of this new scheme and what they need to do to access it. And we've developed resources, as I've said, in languages appropriate to Queensland's diversity. We also hope our work has gone some way to create a greater understanding of the causes of impairment to destigmatise issues around disability, but much more needs to be done in this space. So this is a fact sheet. These are the 2 fact sheets in the 33 languages, but we've also developed 9 audios, those fact sheets in 9 languages in audio format. So you can download all of those or listen to them on our website. So the bicultural workers, if the person themselves may not be literate, it's helpful for someone who's working with them who may be speaking their language, who is literate, can use those resources to help inform the individuals they're working with. So this is a brochure. The NDIS has translated some information. My NDIS pathway brochure has been translated into those 10 languages, and there are some other easy information booklets or brochures that might be appropriate depending on the person's level of English. So if we just have a look at the data in terms of participation rates of people from coal backgrounds in the NDIS, if we look nationally, we know the NDIS expects that 20% of participants will speak a language other than English at home or identify as cold. The latest report from December last year shows us that 7.2% is where the figure is at the moment. So 7.2% of participants identify as cold. So we do have some way to go. New South Wales is doing much better than many other states in that. If we look at Queensland, the ABS data suggests that somewhere between 12 and 15%, depending on which report you read, it does vary, between actually 12 and 15.6% of people will identify as cold or speak a language other than English, but currently the figure is 2.4% of participants identify as cold across Queensland. So we think that needs to grow at a fairly quick rate. It's quite low. We know that people from coal backgrounds have for many decades been underrepresented in terms of accessing specialist disability services across the state, and there are a number of reasons for this. I guess our concern at AMPARO is that many of the barriers in the previous specialist disability service system seem to be evident in this new scheme. We see a lack of information among communities about what services and supports are available, including the NDIS. We've identified that many individuals and families have had, as I've said, no previous contact with specialist disability services. And so we see lots of young children who've missed out on the really important early intervention that they would have been eligible for had someone actually supported them to access federal schemes that were available, and many whose fundamental needs aren't being met, and many who actually need advocacy. Many people that we meet do not have a formal diagnosis of disability or any understanding of disability. Others may have a diagnosis or have a child with a diagnosis of disability, but when you speak to them, they often find it quite difficult to explain what that disability is, and so don't have a very thorough understanding, and often that could be related to the fact that that information hasn't been provided in a meaningful way to them. Most are unsure of what a good life for a person with a disability can look like because they've had limited experiences and access to opportunities for choices that may be available under the NDIS. So sitting in a planning meeting and thinking about what their life might look like on their own without good support and without good information will be very difficult. These issues have been compounded by the fact that generally community and government services fail to effectively promote their services to coal communities through culturally appropriate targeted communication and engagement strategies. We've found through this work, through the participant readiness work, that sharing information about the NDIS and how it works with individuals with disabilities and their families in their own homes with bicultural community educators has actually been very, very well received, and people have actually been surprised at times that we've been able to offer that information, and often this is the most culturally appropriate approach. So other considerations through our work are that in many cases people from COL backgrounds are unfamiliar with the concept of disability. In many languages there's no word for disability. The majority of people we have engaged with come from refugee backgrounds and have, as I've already mentioned, complex unmet health needs. So it has been a challenge to help people understand the complexities and differences between what the NDIS considers a health issue and what is a disability, and what is reasonable and necessary. They're extremely different. I think many people are struggling with that, not just people from refugee communities. The lack of information for many communities also around impairment and disability in the Australian context means that misconceptions and beliefs about the causes of disability were also very common in many communities. As a result, many individuals with disabilities aren't connected or active within their own communities. Some families remain very isolated because of experiences of stigma. And due to issues of stigma, some COLD communities are reluctant to discuss disability in public forums and are much more comfortable doing this in private. Through our work with COLD communities, and in particular those, of course, who have limited English proficiency, we know that access to credentialed interpreters, the provision of translated and easy English information is critical to ensure people can understand important information. It's critical for them to be able to communicate their needs, make informed decisions, navigate complex systems of support, and access the NDIS and exercise real choice and control. Whilst, of course, access to qualified interpreters is often the first step to effectively accessing services such as the NDIS, the system that's been put in place, sad to say, is not working very well. An example of this is in the following story. Who's holding up the time? How are we going? How long? An AMPARO worker recently visited a Somali family with a bicultural community educator to provide assistance for the family to make an access request to the NDIS, and this is how it went. We called the NDIS the 1800 number. There was about a 15-minute wait. I explained to the NDIS worker once connected that I was with a family from a non-English speaking background and they wished to register with the NDIS. I was advised by the NDIS worker that I would need to call the Translating and Interpreting Service, TIS, to get an interpreter and then call the NDIA back. I advised the NDIS that I had already been on hold for some time and that he was able to call TIS to get an interpreter and we would wait on hold. After a few minutes, TIS came online and stated they would organise a Somali interpreter and then call the NDIS back. I realised at this point that the NDIS had disconnected us from the call. A Somali interpreter was obtained and we were put on hold as TIS tried to call the NDIS back. We waited for about 10 to 15 minutes and then the TIS worker came back to us to say that their policy was to hold for only 10 minutes and therefore we would all need to hang up and try again at another time. So what have we found in this work? That the process to contact the NDIS to make an access request is not an easy or effective one if you require an interpreter to do this. And that's obvious from the previous story. We've also found that when individuals and families from a non-English speaking background receive correspondence from the NDIA, because they're often unable to read this or respond to requests for additional information from the NDIS, we hear stories that they've been cut off before they've not been able to respond before the cut-off period that's required for them to respond to the NDIS, and that they have to start again with their access requests to the NDIS. Most people are asking AMPARO for support to contact the NDIS as they lack the confidence, the English language skills and informal supports to do that on their own. We're finding now that because TIS is an automated service, is that saying finish? I can't read it. Does that mean I can, I get extra if I can't read? And there's also a lot of confusion over whether the individual, as that story shows, do you ring TIS or do you ring the NDIA? You should be able to do either. Either should be effective, but neither at this point are very effective. And of course, people themselves are often unaware that they actually even have a right to ask for an interpreter or don't feel confident to ask for an interpreter. So understanding the NDIS and knowing how to access this new system is complex and difficult. Many people are telling AMPARO that they want support to get the access diagnostic assessments. However, we're finding that linking people to clinicians that are confident in conducting culturally appropriate assessments, often with the assistance of interpreters, is extremely difficult. And of course, there are lengthy delays in terms of accessing our public system. People are asking for support to gather the evidence that they need, including impact of disability and access to formal diagnosis reports. Even if they're available, they need support to ask the doctor. They often don't know what to ask for. They want support to make that phone call. They want support to complete the form. They want support to respond to additional requests for information from the NDIA. And many people are saying, you know, we're not funded to provide the intensive pre-planning support that many people need. And we hear that without that, if you're turning up at a planning meeting and you don't clearly know what supports you need, then the outcomes from those planning meetings will be inferior to those people who do have a thorough knowledge of what they need and what's available and what they can ask for, etc. So people are asking for support through every step of the way. So I was really pleased to see on the NDIA, Jen, on one of your slides, it talks about LACs going through each step with individuals. So far we haven't seen that happen in Ipswich and Toowoomba. Certainly that's not happened for individuals who need the level of intense support that we would like to see them get. So the following is just an overview of some of the NDIS responsibility in terms of access to interpreters, because there's a lot of confusion out there about what role the NDIA plays in providing access to interpreters. So the NDIA must provide access to interpreters to assist people to communicate and access the NDIS. Once the NDIS participant has a plan, which the NDIA can also translate, they have access to interpreters when engaging with NDIS registered service providers, including allied health practitioners. When I'm talking about access to interpreters, this isn't in a participant's plan. This is paid for through an arrangement between the NDIA and TIS, the Translating and Interpreting Service. There's fact sheets out there, so if people want to pick those up, it might be helpful. The NDIS fact sheet on language services for practitioners, I've got the link there for you to have a look at that. Just a word of warning that it's a little bit confusing. Some of the information, this seems to encourage services to engage in formal networks to interpret, and we know that this approach is contrary to federal and state language service policies, and those policies strongly discourage using a person's carer, family member or friend to interpret complex technical and sensitive information, which I would say the NDIS information fits into that. So that's one of our concerns about the information, that fact sheet. TIS has also developed an NDIS fact sheet, which isn't on their website. They will email it to you if you ask them. Sorry? 2 minutes, okay. Which provides information for service providers, and copies of that are available outside as well. Some of the difficulties about that fact sheet is it seems to strongly suggest that telephone interpreting is always preferable, and we suggest that face-to-face interpreting, largely for complex information, is much more preferable and based on best practice. Yes. That's a good idea. So what you can do to support people's access to the NDIS, other things that you can do. So supporting a patient's NDIS access request by learning as much as you can about the NDIS. And I know that's a tall order because we're all still learning and things tend to change on a regular basis, but learning as much as you can about what supports can be provided under this scheme. Jen has already spoken in depth about completing the access request form or the supporting evidence form, so I won't go into that. But other ways that you can support access to the NDIS include if you're referring individuals and families from refugee backgrounds to the NDIS, if you have capacity to do more than give them the 1-800 number, of course that would be great. I know some of you won't have. If you have capacity to link them to LACs when they're actually on the ground, that would be fantastic. Find out who else is in the person's life, because if you have the person in front of you and you're trying to complete the access request form, you'll struggle to do that if you don't know the person well, and so you often will need someone, a family member or someone else who knows the person well to be there to be able to complete their access request form. Always recommend engagement of interpreters. Have our fact sheets available in the office so that you can give those to people that you're working with. Refer individuals to advocacy if required, and get to know your local area coordinators in your area as soon as you can and make referrals and seek information from them. Just to let you know, there is an NDIS appeals process. Is the finish thing come up? There's a list of NDIS appeals agencies out there, so it's important to know that people, if they're not satisfied with the decision that the NDIS makes, because you don't always hear about this, that you can actually apply to have the decision reviewed internally. If the person is dissatisfied with that, you can have an external review with the Administrative Appeals Tribunal. The application to that tribunal has to be within 28 days. However, they will grant concessions. So a number of agencies in Queensland have received funding to specifically assist participants to make appeals and to review decisions. So that's on a list of information out there. You can always contact AMPARO if you have any concerns. And there's also on that list other agencies, advocacy agencies, who, without having funding, may also be able to assist. The NDIS pathway, what we need is, we actually need a pathway that truly meets the need of COLD participants and their families, because we don't have one at the moment. The current pathway doesn't meet their needs. The NDIS needs a robust policy framework that actually ensures access and equity measures are part of ordinary business of the NDIS. The cultural diversity of the NDIS needs to reflect the diversity of local communities and regions, and further capacity building and targeted engagement with COLD communities across all regions needs to continue, and our work is, the funding for this work finishes the 30th of June this year, which doesn't make sense. Thank you very much.